you read about all this stuff all year long, but now here are people actually talking about it, can tell you stories about how it really works, etc. That's very valuable.
It's a great place to learn a little bit from folks who know a lot about wearables and at least what they think the next generation is going to be.
Let me just walk you through Apple Watch a little bit. So this is a glance. So if you swipe up on the Apple Watch, you'll actually see a glance. And a glance here shows you a list of patients that the doctor is going to see. So this is actually a doctor's view. So a doctor can also see notifications about a patient coming in and using the digital crown scrolling up and down. Physicians also can see medications on an Apple Watch in a notification. So if there's a prescription refill, they can actually see that on their wrist. They can also get messages from this device that's here today, that's out. Now, this is the drchrono medical app on Apple Watch. So a doctor actually, when they wake up in the morning and they start seeing patients, they can look hands-free at their Apple Watch and see a list of all of their patients that are coming in for the day. You can see details about a patient here, and they're just scrolling through that quickly using the digital crown again, tapping. They can tap and see messages, so faxes coming in. They can see information about appointments on Apple Watch. When you press a force touch, you can actually say that I've read this one, and it finishes and it's read it. You also have chats, so inter-office chats from doctor to doctor, doctor to staff member. And there's other things here like labs and prescription refills. This exists today. This is part of the wearable revolution that is happening. So what I'm really trying to talk about today is, what is the practice of the future? What is a doctor going to be doing in the future in medicine with wearables? I don't know if you guys remember the old bag that the doctor used to carry with them. Back in the 1800s, they'd walk and actually see the patient physically. So they had a bunch of wearables on them when they went to go see a patient. They'd get up, they'd walk out of their office, they'd actually leave the office, go to a patient's home and check on the patient. Physicians did house calls like this, and this still exists today. There's a lot of facilities that actually go and visit patients in their homes. So it kind of is critical to have wearables. I'm going to talk about the problem a little bit in healthcare and what is happening. So here's a list of hospitals you guys can see. And there's a well-known secret in the medical industry. Hospitals actually don't communicate with each other. Medical records from this hospital don't communicate with medical records from this hospital, which don't communicate with medical records with this hospital, which medical records don't communicate with this hospital, and so on and so on. So if you go from one hospital to another hospital, you actually are usually asking for a paper medical chart. Some of them do have digital online medical records, but it's actually hard for you to get that data. And they actually make money for you asking for that data. So you'll go in and say, hey, I had an image done. Can I get that image scanned? And they'll say, yes, of course. We'll print it out on paper for you, or we'll give it to you on a CD. So part of the problem is these guys are not even innately in the cloud. They have their servers in the basements of these buildings. They don't have them actually in the cloud where they can access it outside of the hospital. So I kind of view hospitals very similar to these corn silos. So you can see here, this corn silo doesn't actually talk to this one, and there's silos of data that people actually can't transfer data between the two. And you have to physically take it out and bring it to another silo. And when you think about healthcare, I think about paper a lot. So a lot of doctors use fax machines. Fax machines are sending data back and forth, back and forth. If one doctor needs a referral or needs information about a patient, they generally send a fax. They're not actually just digitally transferring data from one doctor to another. So doctors are very frustrated. They go into practice to become a doctor to take care of patients. They come out of medical school, years of medical practice, and they become paper pushers. I had a conversation with the doctor not too long ago, and the guy was really upset. Told me he didn't want to deal with all of this paper. It's crazy. He literally is a paper pusher all day. Like, he'll see 20 patients, and then he'll have to furiously at night fill out all of these paper forms and try to get medical claims completed. So, if you think about it, what's the most valuable thing out there? It's caring for the patient and giving them the time that they need. So how do we do that today? So how do we fix this problem? So one of the things we're working on in the medical industry is moving data to the cloud. As silly as it sounds, you guys in the room can go from one ATM machine to another across the country and pull out money, and it will reflect in your bank account. Healthcare, not quite like that. So moving it to the cloud can actually help allow people to pull data out as opposed to these servers in basements. Also digitizing medical records. When you think about medical records, I went to a doctor probably 2 months ago. The doctor was completely on paper. And this is me. I went there, and then the doctor was telling me they were backlogged and they weren't billing for some of their patients, and they were losing track of how they were getting paid, and they were completely on paper. They'd see you, they'd fill out a form really fast. They tried to fill it out, they put it in a pile, and they try to review it at some point. It sounds very simple, but getting doctors to use digital technology. But in using digital technology, we need to also rethink how to allow doctors to do their job and take care of the patient and not let the computer get in their way. So if you think about a doctor, a lot of the time they're seeing you and you almost feel like they're just typing furiously and not really listening to you. I mean, if you're typing fast, how much can you really engage with the patient? Are you really looking at them? Are you really caring for the patient? So rethinking design so the doctor can do their job and allow as much data to go into the wearable device. Another thing that we need in healthcare is an API. So data going from one place to another, fixing that hospital problem. drchrono, the company I'm from, we have an API for doctors. And the API is to allow these wearable devices to be used by doctors. Like in the 1800s, the doctor can get up, walk out of the room, and actually just take care of the patient. Have you guys ever heard of a cow? Anybody in the room know what a cow is? What is a cow? It's an animal, yeah, that's right. But your answer is also right. A cow is a computer on wheels. They literally in hospitals call them cows. So when you go into a hospital, they're carting these things around, these really heavy computers. I mean, this is the first thing that slows them down. They just push this thing in the room, and then they walk over to you, and then they furiously go back to that cow. That's crazy. That's not the way that healthcare is. You're sick, right? So if there's something, they need to look at you, not this thing. With the drchrono API, we allow wearables to pull data into the medical record. So here's a stethoscope. This is a company called Echo. Echo did something really smart. They decided if you take a stethoscope, a thing that doctors always wear, and you pull it apart, you can put a Bluetooth device on there that connects directly to your phone, and it streams the heart rate directly into the medical record. You just need an API to do that. There's also Apple Watch, like I just showed you guys. You need an API to be able to pull that data out of the device, but also show data on the device. Here's another one, a blood pressure cuff. So the physician can put a blood pressure cuff on, take a reading of a patient, that data actually streams in. And this blood pressure cuff actually has a Bluetooth connector, so the data goes right into digital format. Digital scales with Bluetooth as well should be put into the medical record. This is a thermometer. Give it to the patient, plug it right into the audio jack of a phone, and you have the reading. This is a heart rate monitor. So you put this on a patient, and you get a heart reading. This device is for patients with diabetes. Do a blood test, pop it right into your phone, and that reading goes right into your phone. So the goal of wearables is to allow the physician to do their job and not have to type as much data as what they're doing. Now, with wearables, the way you have to think about it is if you were, say, doing diabetes readings, usually you're fine, right? But sometimes there will be these situations where there'll be an emergency, and that's where you're going to have to see and analyze the data. You don't want to overwhelm a doctor with too much data. You can pour data at them and then they'll start to ignore it. So you really have to be sensitive to what data you give to the doctor. Because if you give too much data, they're going to ignore the data. You know, I've seen some medical records this big at hospitals, and the doctor, are they really looking through all that data? They may just be looking at the patient's name, their date of birth, and maybe a few of the upper page issues. I'll talk about our company a little bit, and then I'm going to go into some case studies of our company, and then I'm going to go into some more wearables. I'm Daniel, one of the founders of a company called drchrono. We create medical records for physicians. We've actually thought of a term called the Wearable Health Record, where a physician has their hands free and they can see a patient and treat a patient. A lot of physicians want to be mobile, so we put medical records in digital format and many, many mobile devices for physicians to access that data. The company that we started was founded in 2009 by me and my co-founder, Michael. Part of the reason why we started our company was I went to the hospital to go see my father in the hospital, and they had all the prescriptions on the wall. They wrote them on the wall, on a whiteboard. And I wanted to get a copy of those, so I had to take a picture of it with my phone. They didn't have it anywhere else. They were so disorganized in this hospital. And I don't blame the hospital. I think the software is getting in the way a lot of the time. So they wrote all these prescriptions on the wall, and when they left that room, did they really remember what was happening with my father? And my co-founder, something similar happened with him. Situation after situation, where for some reason, a lot of these industries like social networking, Facebook, it's amazing, right? You can find friends from 10 years ago. Banking, like I said, you can take money out from one ATM from another ATM. Music, you can find any song online. Yet with healthcare, things are still behind. It's such a lagging industry that it needs a push. To date, drchrono has 93,000 physicians. We have over 6 million patients, which is roughly 2% of the US population in drchrono. drchrono is medical records for the cloud, for the iPhone, for iPad, Apple Watch, and going back to design, I think it's important, if you're going to design something for physicians, you need to really think about how many taps does it take for the doctor to get to the data that they need. One very famous CEO in healthcare, I sat down for lunch with him, he told me that medical records are almost like a black hole. There's so much data that a lot of these medical record companies have in them that the doctors almost just back away and don't use it anymore. I went to a multi-billion-dollar company. I looked at their software, and they had like 70 tabs across the top screen on a web browser. How do you see a patient and figure out what tab, what screen? They go through these 6-month training courses just to use medical records. It's crazy. That's just insane. So we're trying to think about how do you shrink down the training time for a physician, the fewest amount of clicks, fewest amount of taps, to get the relevant data that you actually need. So in 2016, this year, we won actually an award from Black Book Rankings. Black Book surveyed roughly 18,000 medical professionals, and drchrono came up as the best mobile medical record from this survey. We're also ranked #1 in the Apple App Store for medical records. So if you do a search for drchrono or EHR, electronic health record, EMR, electronic medical record, we come up as the top result. So the way that we think about the workflow at our company is the patient is at home, they're not feeling well, or it's a family member that's not feeling well. There's an app for that. We actually have a web app and an iPhone app and an Android app where you can actually book an appointment online, message your doctor online, view your prescriptions, see your lab results, get a list of your physicians, and do a lot more. I see this as the trip of what gets done. So from home, you would book on our personal health record. We call it on patient. And from there, you would book your appointment, you'd message your doctor, you'd fill out forms, you'd put your medical information in there, and then you could walk into the doctor's office. Say you just book your appointment and you go in. We actually have an iPad app at the check-in area. So you can check in the actual waiting room if you're not going to do it at home. Now, a lot of the times you get a clipboard. They hand you a clipboard in the office, and you're writing your information down 2 times, 3 times, getting frustrated. Go to another doctor, you do the same thing. And a lot of the time you don't even remember what medications you're on or what family members' medications they were on. You could also take a photo of yourself in the waiting room. Kind of important. Doctors see a lot of patients. Say a doctor sees 30 patients a day. Do you really think you're going to remember your face unless you're in there every 6 months or 5 months? So it's really important to get that information to the doctor. Faces are surprisingly highly adopted in our medical records, so you can take a photo from your iPhone or from an iPad. Now, after you fill out your information, this is the point of care tool for the doctor. This is the actual drchrono medical record that the doctor uses at the point of care. So when you come in the room, what we do is we ask the doctor when they sign up for our service, give us your medical forms. We want all the paper medical forms that you're filling out today. We want all the forms that you're trying to leverage. And we have a way to customize this app that allows us to take those paper forms and place them onto the iPad for the doctor. We have really fast ways to input the data so that the physician can get the data in very quickly. So we have quick drop-downs, medical speech-to-text, single selects, macro buttons. So many different ways to enter data. Free draw, you can draw on the iPad. The goal is to allow the physician to enter this data as fast as possible. All of this is also accessible on the web and on iPhone. Now, once the physician finishes seeing you, they can walk out of the room knowing that they've actually documented correctly. A lot of the time, physicians will see their patient, they will leave the room, and then they'll do another 10, 15 minutes of documentation. But they don't do that then. They see another patient, 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 and another patient. And then they go back and say, okay, what did I forget to document? Do you really think that they're going to remember everything? So they're going back at the end of the day at 6 p.m., they're exhausted, and they're going to enter in more data to do cleanup. This happens all the time in medical practices. So we're trying to avoid that if you build out the medical forms properly here. First time you tap a button, it should trigger everything in the back end to allow the documentation to happen properly. And then we also have billing and business intelligence tools to allow the medical billers to see this data as well to do the billing, because the doctor has to get paid. Here's some of our chiclets. Chiclets are the things that are on the Android device or the iPhone. There's the patient app, the check-in app, the point of care tool, and then the medical billing tool. So again, just so you guys see it visually, we actually have everything across web, iPhone. We're also trying to create a good experience for the people that are actually running the organization. So a lot of the time they're fighting with insurance companies back and forth. They'll submit a medical claim and it'll get rejected. And they'll submit a medical claim and it'll get rejected. And doctors actually stress over this because they need to get paid for their practices. So we're trying to streamline this so they understand how their accounts receivable are going, right? If you're going to see a patient, you want to get paid in 30 days. A lot of the time they forget about it, they ignore it, and then they just don't get paid. We're focusing on everything but hospitals. Hospitals are big beasts, and they buy very, very expensive software. How much do you think the install of software, EHR, for Kaiser was? Any idea? Tens of thousands?
5 million.
What's that?
10 million.
10 million?
Wow.
It was over $5 billion for Kaiser's medical record software. So most doctors can't afford that. So drchrono is actually giving away our medical records for free to doctors. We actually give them away for free. Why would we do that? That's insane. We could charge $5 billion. Well, most doctors can't afford $5 billion. So we're looking at free medical records all the way to very expensive medical records. If you're an acupuncturist that's just starting your practice, you can't buy software because you're just starting your practice. So this is a perfect plan for people like that. But if you're like an orthopedic surgeon who's making $4 million a year, you kind of want the best plan. You want the support, you want the bells and whistles, you want a medical billing team that advises you. So we give everything across the gamut, depending on the specialty, depending on their needs, depending on their price sensitivity. We focus on all practices, every specialty. We take their medical forms and put them online digitally. And again, just going back to the API point, we have an API. Here's a few of our API partners. And the critical thing about an API is that it allows wearables to come in. So like I showed you that stethoscope, that connected Bluetooth stethoscope, you need an API to allow that company to build on top of what you have. So here's some of the companies here that have built on top of drchrono. We have things like ZocDoc. Anybody know ZocDoc? So you can schedule an appointment online from like a Yelp type service. We have roughly 500 developers building on the API, over 7 million API calls. So in our API, you can also do other things, like connect to any lab in the United States. We use a company called Health Gorilla. They go out and talk to any lab, and they will actually have a team take the data. Once you get your blood work, it'll pull that data digitally and place it into your medical record. As silly as it sounds, it's actually a very complex thing because there's all these different labs all across the United States. So you can see here they're just connecting the lab. The physician here is doing a lab order, and this is through the web interface. But you can also do it through your iPhone. This is a whole other company inside of the medical record that we're putting inside of the medical record to actually allow the doctor to use the lab that they want to use. A lot of the time, a doctor will be forced to use whatever lab the medical record company has. So if you're in this region of the United States and there's these 4 labs around, and then you buy this one medical record company software, a lot of the time you're forced to use whatever lab that software is integrated with. We think that's wrong. So we're working with this company to allow the physician to pick the lab that they want to use and pull that data in. We're creating a modern API that just simply works. So just to reiterate, drchrono does medical records, we do medical billing, we have an API, and we also have apps for patients. Now, I'll talk to you guys about the White House a little bit. I What does the White House have to do with wearables? What's going on there?
Regulations.
What's that?
Regulations.
Regulations, yes. They're actually interested in the API that we built. They approached us, President Obama and his team had approached us to build with them. So President Obama and his team have created something called the Precision Medicine Initiative. The Precision Medicine Initiative is an initiative to help patients get better care. Now, what that means is generally doctors sort of take an approach that if this works for 80% of the patients, it might work for you. That's the approach and the way that they think right now. They work on percentages. If this works for 25% of the patients, it might work on you. Imagine fixing a car thinking that way. Well, 25% of the cars I fix just need their tires changed. Let's try that first. That's crazy. That's the way that healthcare is done. So if you have cancer, there's a drug, and they'll be like, oh, this works 50% of the time, let's just try this. And they give you that drug. What President Obama and the government thinks, they think that this is wrong. They said, wait a second, let's rethink the way that we're doing healthcare. It shouldn't just be based on percentages. Let's take genomic data. Let's take medical record data and merge it all together in one place. They call that a coordinating center. And let's make a decision based off of patients like this patient and their genomic data and their medical history. So we're working with the White House to pull data out of drchrono and help them towards this goal. So here you can see our app, drchrono and OnPatient, and we're pulling data out of other EHRs. And I mentioned the genomic data. I'm going to show you guys a couple of fun pictures. I went to the White House, I think it was 4 months ago now. This is from my iPhone. I took a picture of President Obama. While he was talking about this exact issue, he said he believes we can do better with healthcare. And I agree with him. I think genomic data should be brought in. I think if there's someone that has cancer, you should be able to pull the data from all of medical companies, medical record companies, put it into one place, let the physician see that, but also pull in genomic data to see what would this patient be more like, what would help this patient more likely. So if you have the genomic data, you have the medical record data, you have data from other patients that are very similar to this patient, their assumption is the outcomes will be way better than what we have today. Here's a fun picture. This is actually President Obama's dogs, Sonny and Bo, at the White House when I was there. I'd like to talk about this company, White Glove. So they deal with very, very sick patients, and they're a mobile medical company. They come to the patient's house. So if a patient is homebound, they can't leave the home, this company will send people to that patient's home. When you can't leave your home, say you have a broken leg or you tore your ACL and you have nobody to take you to the hospital, for some reason you can't leave the home, this company will help. They have 74 providers on drchrono, all mobile. So mobile providers can't be using cows, right? They can't just get this out of a van and start dragging it to your house. They need to just walk into the house with a small tool set of things and just drop it on the floor, take care of the patient. That's really what needs to get done. Dr. Saini, he's a gastroenterologist in Newport Beach, California. I should have put a video on here of him doing medical speech to text. Phenomenal. The guy just talks into his iPad and it just immediately creates this beautiful medical record for him. Some people are just really good at medical speech to text. He's one of them. Depends on the doctor. We ask the doctor, how do you like to input the data? And depending on what their answer is, we curate the medical experience for them differently. Here's William Wall. He's actually around here. He wanted a free draw. So free draw is drawing to show the patient what's going on. right? So you want to create a multimedia medical record experience. You want to educate the patient. You want to draw on the medical record and say, this is where I'm going to be doing this surgery. And then they can send it to the patient. The patient actually gets a copy of what the doctor has just spoken to him about. Here's a plastic surgeon, Dr. Dick Tabin from New York. He simply just wanted to get access to his medical data anywhere. As silly as it sounds, that's not usually the case. Here's Dr. Metaxas. He wanted real-time notifications and to have a better patient experience. Here's a photo actually of a patient using the patient check-in app. He's walking over to the waiting room and he's going to fill in all the information. Our last case study is Dr. Jawaharian. He is an urgent care clinic. They're sort of a hybrid. So they go to the patient's home or the patient comes to them. They're actually in Berkeley, California, Mountain View. They're in a few locations and they're growing very quickly. So they needed something mobile because they're dealing with patients and they need to move the hardware very quickly. So why now? Why wearables and why now? I'll just go into some of the technical. Moore's law says that transistors will shrink every 2 years. So the actual physical hardware will shrink. And you can see here how hardware is getting smaller and smaller and smaller, and they're putting more and more transistors onto this hardware. So from 1971 to today, in 2011, you can see that things are they're just putting more and more onto these devices and they're getting smaller. And now we're at the iPhone. This beautiful device, and now people are using this and they have Apple Pencil where they can actually write even better on these things. And billions of people have smartphones. This technology is taking off. Part of the success of where wearables are coming from is Bluetooth. So Bluetooth is allowing these devices to connect. It's allowing them to pull and push data from, say, a stethoscope. And there's all different types of wearables and things out there. Now, one thing I wanted to talk about with iPhone 7, they allowed you to figure out exactly where you are. So they don't have this today, but part of the future that I see is that people will have something. Maybe it's an implant, or they'll have a beacon that they put in their pocket or something. And if they're at a hospital and a physician walks near them, the medical record will flip open. So they won't even have to touch it. Maybe it'll flip open on the wrist, right? So they'll come near the patient and then it'll show them the most important information. You know, this patient had a heart attack 4 hours ago, or a patient needs surgery immediately. So allowing devices to know where they are is super important. Hospital bed assignment, right? You have 60 patients in a hospital, 200 patients in a hospital. If you really think about the physician, he wakes up in the morning, goes to the hospital, sees like 4 or 5 patients. When he comes over to like a family member that's yours, where's his mind at? Like, how much does he really know? How much is he really aware of at that moment? They give him that stack of paper and they give him a cow, and then let me try to figure out what's going on with this patient. And the cloud is extremely important to push and pull that data. I just wanted to do a quick mention of this. Funding is really important. So the world is sort of changing. Things like Kickstarter are allowing wearable companies to build things very quickly and get it off the ground. Y Combinator, the accelerator, invests very aggressively. This has never really happened in the past. In the 1980s, you had to go to a VC, a venture capitalist, and you'd have to convince them to give you like $50 million. Why? Because you needed to buy the servers to put in the actual startup, and you'd put $10 million worth of hardware into this startup. Now that the cloud is around, you can start something very quickly, and hardware is getting cheaper, you can build things very quickly. These guys are willing to invest pretty aggressively and very quickly. How do wearables become successful? You can distribute software very quickly and connect wearables very quickly. So the Apple App Store, the Facebook Store, Google Play, You can find the software very quickly now, as opposed to before when you had to, in the 1980, 1990, you had to walk to the store, physically buy something, put it into your computer like a CD to load it in. I'll give you guys some quick quotes. In 2015, there were 2.5 billion connected devices. By 2020, there'll be 30 billion connected devices, not PCs, smartphones, or tablets. What are those things? 100 things are coming online every second. 1 in 6 consumers owns a wearable device. I bucket wearables into 2 different categories: FDA-approved devices and non-FDA-approved devices. So an FDA-approved device allows a physician to make a decision off of that device. So you can ask the physician, is this FDA-approved? Because he can make a decision off of that. Non-FDA-approved devices, you really shouldn't. The government is not, the FDA hasn't approved it, so you probably should not use that device. As a consumer, you can use that device, but the physician should not be using that device. So I'll give you guys some wearables, walk you through these. The intelligent stethoscope, the Echo stethoscope. I'll show you a quick video of it. So connecting drchrono to this device, they're doing a single sign-on like Facebook, where you OAuth in. Once you connect it, this device becomes aware and pulls in a list of patients right here. You can select the patient, select how the patient is laying, put the device on the patient, get the heart rate reading, and then that goes into the medical record when you hit save. Simply hit save, boom, goes right into the medical record. How awesome and cool would it be to have your heart rate, your doctor sending you a copy of your heart rate? Oh, you have a heart murmur, let me send you your heart rate, and this is where the heart murmur is. Just so you guys can see the wearable pulling in the data here. This is drchrono on the web. The physician is going into the medical record. They're clicking and they can simply go down and see the actual heart rate monitor here, so they can see the reading. I wanted to just give you guys this one, just to sort of change things up a little bit. Anybody know what that is? Stent, yeah. When I was creating this slide deck for you guys, I was like, is this really a wearable? Maybe. It's not connected to anything, but you're wearing it all the time. So what a heart stent is, if you have a clogged artery like this, physicians will place this little tiny bit of metal in, and it will expand out and let the blood flow properly. You guys can decide if that's a wearable. It's literally inside of you all of the time. Now, sleep apnea, when you fall asleep at night, sometimes your tongue will actually relax and close in on itself. So here's a healthy breathing path. Here's actually someone with sleep apnea. Usually people get sleep apnea machines. They put this on a CPAP machine, and it helps them breathe better at night. But there's companies like Wearable Health that actually are creating ways to diagnose you. So usually for sleep apnea, I don't know how many of you have had sleep apnea tests. The physician will make you go into the sleep apnea clinic. They'll have you sleep there. You'll come out, they'll give you a whole report, and it's actually very stressful. They'll put all this stuff on you, they'll put all this glue and all this weird stuff. They're like, okay, go to sleep. Who's going to go to sleep with all this stuff on? So it's actually very, very disrupts people. This company actually, with the software that they're building, they can put this into a wearable, but right now they're putting it into phones. You can tell where the pauses are, and if it's sleep apnea. So here's sleep apnea right there. And they'll tell you with the Wearable Health app. They're also shipping devices to people's homes. There are companies that are building actually telemedicine. So this is a company called Kivatinos Health. You're actually going to have a conversation with a physician. So imagine having a pain in your foot. You could actually, in the future, be able to talk to them on an actual wearable device. Right now, they're pushing the boundary in terms of it being on mobile phones. Glucose meters, I mentioned. Things that tell you when you should be drinking water, a company called Hydrate, heart rate monitors, fertility tracking, and thermometers. Remote thermometers are better stickers. 3D printing prosthetics coming out. Genomics. Lots and lots and lots of different things. This is something from Hippocrates. Have you guys ever heard of the Hippocratic Oath? Here's actually a copy of the Hippocratic Oath. This guy is considered the first physician ever. So here's a copy of it in English. I like this quote. He says, "Cure sometimes, treat often, comfort always." Awesome. Thank you guys for the time.